Hi, everyone. Dr. Eric Westman here. I'm going to be giving a 2-episode seminar series on looking at your lab work, how to decode your laboratory tests. Thanks for chiming in. Thanks for those watching on the live, and thanks for those watching on the replay. It's my pleasure to be able to talk to you for a couple nights, about a half hour each time. Tonight, there will be no time for Q&A, for question and answers, but tomorrow night there will be. So I'll be here Monday and Tuesday night, tonight and tomorrow, 8 p.m. Eastern time on the same channel that you're watching on. Of course, we just opened the Keto Made Simple Master Class at adaptyourlifeacademy.com. If you're interested, check it out. The class is open for enrollment now. You can go to the Adapt Your Life Academy, look and learn more about the class, or you can get on a waiting list, or you can just sign right up. The class we're going to talk about in more detail tomorrow night at the end of the lab series. So thanks again for joining. I'm going to pull up some slides. And so give me just a moment, and I'll be talking in the background. So this is part 1 of decoding your lab tests. I'll be talking 2 nights in a row, again, part 1 and part 2. So thank you for joining in. And if you haven't started a keto or low carb diet, that's fine. I'm going to be talking in general about laboratory tests. If you have started a keto or low carb diet, I'm also going to give some sidebars here and there about what I see and what you can expect on a low carb keto diet. So I won't just be talking about keto diets, but I won't ignore keto diets either. Here's the outline for the workshop. Why are blood tests important? How to understand your blood tests for the best outcomes. How to assess your cardiovascular risk. Tonight, we'll talk about the blood lipid profile. Tomorrow night, about the blood glucose, the diabetes and pre-diabetes lab tests. Which tests assess thyroid, liver, and kidney function? And why should you have those tested? Turning these results into a treatment plan. Red flags to watch out for. How to work with your doctor to monitor progress. And then at the end, medications and what they're used for, the most common medicines being used today, and how they can be reduced or eliminated with lifestyle change, which is really what I do in my clinic at Duke University. It's a great job, I have to say. So why are blood tests important? The way I like to think about blood tests is that they're like indicator lights on your dashboard of your vehicle. So they're important to know how your body is running. While some select abnormal blood tests require urgent treatment, like extremely low potassium or sodium, most tests are used for prevention or monitoring of chronic diseases like diabetes or cardiovascular disease. I was in my car recently, and one of the indicator lights, dashboard lights, went on. This is like a blood test. So I looked to see, and it was the window washer fluid was low. Well, okay, that's not urgent. I didn't pull off the side of the road and make any change. Occasionally, these other lights come on, and I kind of ignore them. So there are a lot of blood tests that we just watch, and they're not very urgent or worrisome. It means you have to watch it or repeat it over time. So I put in some window washer fluid, and the light went off. Another time, one of the dashboard lights it was the engine light. It was the check engine. And when I went into my mechanic's office, they freaked out. They said, Dr. Westman, if that check engine light comes on, don't drive your car. You have to call a tow truck and tow it in, because even if you drive a half mile from there to the mechanic, you could ruin the engine. Well, so I got a kind of a drubbing, or yelled at, as mechanics could yell, but basically scolding me for ignoring the important light. So I don't want you to be in that situation with lab tests either. And some people are even getting lab tests on their own and then bringing them in. And I think that's fine. Some of them are outside the normal range, the indicator light on the dashboard going on, and it's no big deal. Others are outside the normal range, and they are a big deal. Although in general, if you're feeling well, you don't have to be too concerned about the lab tests if you're just checking on your own. But so think of these, because there may be 20 or 30 blood tests, especially those red blood cell tests. There are all these different ways to slice and dice the red blood cell, the size, the shape, how much hemoglobin is in there. Most of those are not so worrisome. And so it's kind of like, filling up the window washer fluid. I had an old car once, though, where the indicator light would come on and off and out, and that when you go to the mechanic, it would never be on. And anyway, so sometimes you might have a pain or a symptom, and you come in and you don't have it at that moment. I understand. Most doctors understand that. So when you look at lab tests, most blood tests follow what's called a normal distribution, with an average value in the middle and then variations around the average. Some blood tests are kept within a very strict normal range and have a small deviation may represent a serious problem, like a sodium, like on the left here at the bottom. A normal being 140. If you have a very small deviation to say 148 on that sodium, that's worrisome. Or down to 132, even though the number change isn't very big, it's very unusual to have a sodium level to be outside that range. Even on a low carb keto diet, the sodium is something that is protected, and the body makes it keeps it in a very narrow range. And it's very unusual on a blood test to have that come out abnormal. If it is, you want to get it checked out for sure. On the bottom right here, some blood tests have no immediate danger at all, even if abnormal. And I'm going to let you know that there's no total cholesterol level that would make me so worried, like that check engine light, that you need to have immediate treatment. Actually, there's a triglyceride level in the blood, the serum triglycerides. If it's 10,000, yes, your doctor may hospitalize you or send you for treatment. But there's no cholesterol level. So it can be a wide range there. That's total cholesterol. We'll get into the detail of that. But the main point being, like indicator lights, some of them you want to be really concerned about immediately. Some you don't have to be so worried about. So,
Doctor, I'm sorry to interrupt you. We don't see slides.
Oh, no. Okay. Let's see. Let me go back and share my screen. Thank you for stopping. And let's see. Let's see. Okay, here we go. Well, I was getting into this so much, wasn't I? How's that? Getting better?
It's closer? Better. Yeah, just go to present mode and we'll be good.
Closer. And so I'm going to go back. Here's the outline. In fact, here's the Decoding Your Lab Tests, part 1. The outline that I'll be going through. Why blood tests are important. I hope I gave you a visual in your mind of that dashboard. And then this is a slide I want to just stop on for a moment, that normal distribution curve. And on the bottom left is the sodium. Very small deviation can be very urgently needing treatment. The bottom right, cholesterol levels can be, hundreds and 500 for a total cholesterol, and I wouldn't be worried about it like the sodium. So now looking at the detail of cardiovascular risk, and I have to say this is probably the most common question I get for people who are starting a low carb diet or concerned about starting one, or even people who are on them, because there are other people who are very worried about this. And I'd like to explain why I'm not so concerned. This is also known as a blood lipid profile or lipid panel, and it's typically done in the fasted state, meaning you haven't eaten for 12 hours. And that's to reduce the contribution of the food that was recently eating. So this is the kind of faux pas or problem that I see. The first thing is you want to make sure it's a fasting test. If you're going to look at the levels of cholesterol, and that includes triglyceride and HDL, make sure that you haven't eaten overnight. Even things like caffeine, like coffee, can be a problem. Some doctors minimize that, but you want to make sure you haven't had anything but water on that morning. So the fasting lipid profile includes the total cholesterol, and for this purposes of this slide or this slide deck, I'll say T col for total cholesterol, LDL cholesterol, LDL-C, C meaning cholesterol, HDL meaning high density lipoprotein, LDL meaning low density, and you don't need to worry about that. That has to do actually with where it falls on this this laboratory test, the low density, high density, but we just shorten it to HDL. Triglyceride or trigs, you might hear it that way. And then the non-HDL cholesterol is the remainder after you take the total minus the HDL. So all of these are ways to look at the lipid molecules in the blood. Standard lipid profile or lipid panel that most doctors get. The total cholesterol is the measurement of cholesterol carried in all of the lipoproteins combined. Lipoproteins are carrier, they're not really molecules. There are a lot of molecules, but they're proteins and fats all together. Basically, the lipoproteins help take the fat-soluble things through a water-soluble bloodstream. And so you can think of it as sort of like a UPS or FedEx truck taking materials around inside the bloodstream. The HDL-C measures only the cholesterol inside HDL particles. And the lipidologists, and these are doctors who subspecialize in just treating, well, they focus a lot on measuring and treating cholesterol, get very persnickety about, it's not just an HDL, you're talking about the HDL cholesterol being measured. That's okay. I'll kind of gloss over those minor details for this presentation. But an important point on this standard lipid profile is that the LDL-C isn't actually measuring the cholesterol. And it was kind of a shock for me to learn this some years ago. It's calculated by an equation called the Friedewald equation. It's not directly measured. And it is kind of shocking to think that this number that people are putting so much emphasis on, the LDL. So if you get the report and it says LDL calc behind it for calculated, what's happening there is they're using the Friedewald equation. They're taking total cholesterol minus HDL minus triglyceride divided by 5 as a proxy for the LDL. Well, this is the most common type of lipid test, but LDL is calculated, not measured directly. So the LDL particle size and particle number are not measured. These are called advanced testing. I'll get into that in a moment. The problem here, as you can see, if you change the triglyceride level, you'll change the LDL level, even though the LDL wasn't changed. And that's just because you subtract the triglyceride divided by 5. So if your HDL and the HDL is subtracted, if these change, then the LDL will also change, even though a direct measure of the LDL may not change at all. Just to show that it's shortcoming of the Friedewald equation, in that first bullet, if the triglycerides change, then the LDL calculated changes. Not because LDL has actually changed, but because the formula includes triglycerides. So in number 1 here, if the total is 200, the HDL is 50, triglycerides 200, you calculate the LDL, it's 110. But if the triglycerides go down to 50, and the 200 total and the HDL is 50, those are the same, then the LDL will go down to 140. go up to 140. So lowering the triglyceride in the blood can artificially elevate the LDL by calculation. And this is one thing that happens to people on low carb diets, because triglycerides go down typically, I'd say 95% of the time. The HDL stays the same or goes up. The LDL can actually go up because of the triglyceride going down, because there's a reciprocal relationship. To get around this, you can measure LDL directly, which is what I would recommend if you're checking the blood. But I'll even plant the seed that you want to go beyond checking these blood tests, because this is kind of confusing, isn't it? It's almost like me going to the mechanic and the mechanic telling me all the detail they did in changing. And I said, no, just tell me you fixed it and let me know what I owe and when I need to bring the car back. But these tests are being used by doctors. Many doctors don't know that this LDL calculated is not even a measurement of the LDL directly. So for some time, I'd say 15 years now, the NMR lipoprofile or VAP test or advanced lipid testing has been available. And so the VAP test measures multiple subfractions of LDL and HDL, and it directly measures the LDL rather than calculating it. The NMR lipoprofile, interestingly, the company started in Raleigh, North Carolina, and I actually met with the owner of the company back in the day and did some of our studies through the NMR lipoprofile platform of low carb and low fat diets. That's where I first got the demonstration that low carb diets reduce cardiometabolic risk by addressing the metabolic syndrome, the triglyceride and HDL in the blood. So the NMR lipoprofile measures these multiple subfractions of LDL and HDL. It directly measures LDL rather than calculating it, so that's an advantage. And it also gives an LPIR score, which is a lipoprotein insulin resistance score, which in many studies, that's the most important marker in large prospective and observational studies of cardiometabolic risk. The LPIR score is the most powerful thing, which also is an indicator that the world paradigm, the world of cardiometabolic risk measurement is shifting from just looking at LDL cholesterol to looking at the insulin resistance factors, because this is the NMR lipoprofile of all the things that you could look at. That one LPIR score overwhelms the importance of all the others. These are better than the standard lipoprofile, but you're still measuring the cars and passengers in the bloodstream. You're not measuring the road conditions or the arteries themselves. So we're not trying to just affect the cars and the passengers. We're trying to minimize the damage on the arteries, if you will, the road conditions. So neither the number of these particles nor the amount of cholesterol in them tells you whether or not you have damage on the arteries, called atherosclerosis. So I've gone beyond just looking at blood, and I ask people to actually get their arteries measured. It's much like if you were purchasing a house, you get the house inspected. You have the pipes looked at, and you don't just look from the street and say it's a nice neighborhood, the house must be great. No, you go in and you do an inspection. So looking at the blood tests gives you an indicator, but what you want to know is actually, do you have disease on these arteries? So when you're looking at a blood lipid panel, cholesterol, keep in mind several important points. Cholesterol doesn't exist freely in the blood. Cholesterol is carried in lipoprotein transport particles from the liver to the cells, and from the cells back to the liver. So cholesterol going around the blood isn't going to glom onto your arteries. Neither the number of lipoprotein particles that are carrying around the cholesterol, nor the amount of cholesterol in them tells you whether you have atherosclerosis or not. And it's kind of defying my sense of reason now. Getting older, I'm getting older. I'm practicing now for 30, 40 years. that doctors shouldn't be treating you for a disease that they don't know you have or not. So a cancer doctor wouldn't give you chemotherapy if they didn't have a tissue diagnosis of cancer. A cardiologist, a family medicine doctor, an internist shouldn't be giving you medicine to prevent a disease that they're not sure that you have, or even if you're at high risk, that's one thing. If you've had it already, that's another. But even though you may be high risk, it doesn't mean you have it. So if you've gone through 70, even 60, 70 years of life and you don't have any evidence of atherosclerosis, even given whatever you've been doing, you don't have the disease. So you haven't shown yourself to be at high risk, and yet the cholesterol level will be used as a reason to try to get you to be on a medication to reduce it, the cholesterol. But we're not trying to just reduce cholesterol. We're trying to reduce the atherosclerosis on the arteries. So there are ways to measure for the atherosclerosis. One way to do it is the coronary artery calcium scan, or CAC score, you might hear it referred to. The coronary artery calcium scan is a CT scan, so there is some radiation exposure, and it measures the calcified plaque in the coronary arteries. The test shows the actual plaque present in these arteries, the problem itself in real time, rather than just risk factors that may or may not indicate anything about your cardiovascular health. A CAT scan, or excuse me, a CAC scan assesses the road conditions, if you will, rather than counting the number of cars and passengers on the road. A coronary artery calcium score can also identify heart disease if you don't know you have any signs or symptoms of it, and that's how it got popularized. That it caught what was known, it was called a widowmaker lesion in an influential person who then tried to popularize this as something everyone should get. And in that case, it saved his life because he had no indication that there was a problem. There's a movie about this and some books written about it. For some people, the first sign of cardiovascular disease is actually death from a heart attack. So sometimes it can rear its head, and we have no way to know if you're at super high risk for it. A coronary calcium scan might alert you to this high risk. However, interpreting the results, it's kind of like opening a Pandora's box, if you will. If the coronary artery calcium score is 0, it's very helpful. It's ruling out the problem. And as a screening test, if it's very sensitive and it's a negative, it rules it out. So if the coronary artery score is 0, this is extremely helpful. But if the coronary artery calcium score is greater than 0, the interpretation is complicated. The plaques may be very stable and unlikely to break away and form a clot, or they may be unstable and more likely to cause problems. Calcium can be a sign of healing of the artery plaque itself, and it doesn't measure the inside or narrowing. This test doesn't tell you if you have narrowing of the artery there. It just says that something was happening there, that calcium has been deposited. There's very little evidence that arterial calcification can be reversed, but it may be possible to slow the progression. And in the studies where they've sort of said you can reverse this, it's been a very small change, statistically significant, but not clinically significant. You would see case study after case study after case study of reversal and elimination of this if there was something that actually did that. A small number of anecdotal reports show regression and reduction, but these could be unreliable. They've not been replicated in large studies. And in my anecdotal experience, often these people are selling you products that, guarantee that you'll have regression. I don't really know that those exist yet.
Doctor?
Yeah.
Sorry to interrupt again. Can you click hide on the that little notice at the bottom?
Oh,
yes.
Of course. Oh, got it.
Thank you.
Oh, did I just ruin the screen?
Oh, it just hid the whole thing.
There we go. Is it
There
back?
we go. Yeah, no, I don't see it. Now we're good. Thank you. Sorry to interrupt.
Thanks, Kyle. Thank you, Kyle. So the last bullet here, and this is because of several studies, one called the MESA study. It's currently believed that a 0 score indicates extremely low risk of a heart attack over the next 10 to 15 years. If you have a 0 score, it's suggested you don't need to test again for several years. And I've seen this kind of the coronary artery calcium score misinterpreted. Recently, a patient told me, another doctor said, well, it doesn't measure uncalcified plaque. Well, that's true, but still in these large clinical trials, it confers almost a 0 risk of a problem for the next 10 to 15 years. So whatever process is going on, if you have a 0 coronary calcium score, it's very helpful. If you're over 0, it's just not very helpful, I'm afraid. You might have some disease there. There might be significant narrowing that you don't know about, I'm afraid. Now, getting away from radiation, CAT scans, an ultrasound measurement can be done of the arteries of the neck, of the aorta. You can't measure the arteries of the coronary arteries of the heart with ultrasound yet. From the outside, you can put a catheter in and measure the insides, but carotid intermediate thickness tests and several other ultrasound techniques from the outside can give you a non-invasive way to look at the thickness of the layers of the neck artery, the carotid artery that supplies blood to the brain, neck, and face. The measuring of the intimate thickness is named because of the arterial layers called the intima and the media. That's the carotid intima media thickness test. When these layers are thicker or there is plaque buildup, then there's greater risk for cardiovascular events. Like the coronary artery calcium scan, a CIMT test can detect problems even before symptoms are present. So these can be used as preventive tools. Now, the CIMT does not measure calcified plaque. It's not a CAT scan, not detecting calcium, but the CIMT measures the thickness of the walls of the artery, which greater thickness is more frequently linked to worse cardiovascular health compared to thinner layers. You may have heard of a carotid Doppler ultrasound or other ultrasound techniques, and the CIMT is similar to that, but not exactly the same. I think the CIMT is thought of as a more precise indicator. If you have a ultrasound test and it's not normal, it suggests some disease, then you would want to follow up with a carotid intima media thickness test. So I'm a big fan of these more direct measurements of atherosclerosis. So I know we're talking about lab tests, but lab tests have their limitations. And it's important to know that elevated blood cholesterol is not a disease. And I coach my patients to go into their doctor and say, well, what are you trying to prevent? Elevated blood cholesterol is not a disease. It's a predictor, at best, it's a predictor for the disease called atherosclerosis. So a limitation of even the cholesterol levels is that approximately 50% of people who have a heart attack do not have high total or LDL cholesterol. So if you're just relying on this, you're not going to be able to know for sure if you're at risk. So it is possible to have normal cholesterol levels in the presence of highly calcified arteries. It's also possible to have very high cholesterol levels, but have no arterial plaque. So, the whole construct of measuring cholesterol in the blood to predict and tell you whether you're at risk and give you drugs to prevent atherosclerosis is fraught with problems. And there's a segment of the medical world in evidence-based medicine and personalized care where actually we help you figure out what is your personal risk. And if it's extremely low, using these measurements with the addition of inflammatory markers or the coronary artery calcium score, those sorts of things, then you may not have to be treated for a high cholesterol. High cholesterol is not a disease. So how do you assess whether you have these problems? So the takeaway from this session, the standard lipid profile is limited. The LDL is calculated even, not measured directly. There's no detail about size or number of LDL particles. So be very wary of just looking at that kind of test, and be sure you're fasting. There are more advanced tests than the standard lipid profile, but elevated blood cholesterol is not a disease. Atherosclerosis is the disease that we want to prevent. And you can assess whether atherosclerosis or arterial thickening is actually present using tests like the coronary artery calcium scan, the carotid intima media thickness test. The CAC, or the calcium score, requires a doctor's prescription, probably because of the radiation exposure, or it might be because of we like to have monopoly on these things, we doctors. The lab test, though, you can get without doctor's orders in most states. The carotid intima media thickness test is an ultrasound. You don't need a doctor's order for that. There's a company that goes around in our area that will do it for you at your own expense, but it's not exorbitant. There's another kind of CAT scan that requires a doctor's order, and it's really under the purview of cardiologists, where they give you some injection of a dye that lights up the coronary arteries on the CAT scan. So that's called a CT angiogram. And if you've been following my talks, we've been clucking a lot about this new study about lean mass hyperresponders, because they're actually looking at the arteries inside these folks who have really high LDLs under the circumstances of low carb diets. And they presented the baseline results, and half the people who had super high LDLs had no evidence of any sort of coronary artery disease at all on their baseline scans. Now they're going to be followed for another year to see if there's any progression. And the ones who had some disease had very minor disease, no greater than compared to a different independent group in the Miami Heart Study. So if you need more detail about my take on the lean mass hyperresponder study, please look at the Adapt Your Life YouTube channel. That's my YouTube channel. Well, that's tonight's Decoding Your Lab Tests. We went over the normal range, and apologies about the slide. It's been a few months since I did a StreamYard using slides. Sorry about that. The normal range could be for sodium or potassium or chloride or CO2 measurement. It's very tightly controlled. The normal range for something like cholesterol might range over hundreds. So if you don't know how to interpret these tests, please talk to your doctor or health care practitioner to learn more detail about the context. And of course, if you're not feeling well, we might interpret these tests differently than if you are healthy and you're just checking them for preventive kind of understanding. Please tune in live tomorrow for part 2. We'll talk in detail about blood glucose, diabetes, and other blood tests that you want to be following. It'll be 8 p.m. Eastern time at this location. Then we'll have time for questions and answers, and we'll go into some detail about the Keto Made Simple Masterclass that's open now at the Adapt Your Life Academy. If you're interested in getting started with lifestyle change, or if you need a rebooting at the beginning of the year, we're here to help you with that. And thank you so much, Kyle. I appreciate your helpfulness. And were there any urgent things I need to think about in the chat tonight?
Well, there's quite a few questions. So what I've advised people to do, hello everyone, is to you can email us at academy@adaptyourlife.com, and I believe there will be Q&A after the next session. Is that right?
Yes, that's right.
Yeah.
Say that again, to email us at Adapt Your Life Academy.
Yeah, I put the email address in the chats.
Okay. Great.
So and here is the link to the masterclass coming to all the channels.
Fantastic. We're really excited to get started helping people with lifestyle change, rebooting. And tomorrow night, we'll talk about all the wonderful things that can happen with simple, just changing the food. Pretty amazing. Thanks again, Kyle. Have a great evening.
My pleasure. Good night, all.